I'm going to be giving you an overview of the Department of Epidemiology. I'm Jill Norris. I'm chair of the department. This is the vision and mission statement that we've developed, and I think it's a nice sort of roadmap for this presentation. Our mission is to provide high-quality training in epidemiology, conduct cutting-edge population research to advance science and knowledge about the causes, consequences, and prevention of disease and injury, and translate knowledge to promote health through advancing public health practice and policy. We have 31 primary faculty. 11 of these primary faculty are at Colorado State University in the colleges of Agricultural Sciences, Applied Human Sciences, Liberal Arts, Natural Sciences, and Veterinary Medicine and Biomedical Sciences. I always think it's nice to put a face with a name. So this is our composite. These are the epidemiology faculty at CU. You'll recognize some of them from this meeting. We have multiple roles of associate deans of public health practice, dean of the school, emeritus dean, and a university distinguished professor. And you're going to be hearing from two faculty in the department, Tasha Fingerlin and Dawn Comstock. And you will also later on in this afternoon have the privilege to hear from Donna DeBelia. And it'll just give you a snippet of the research that we're doing. These are our faculty at CSU. We don't necessarily get to see them very often, but they're very important to our research and educational mission. And Loran Stallons here is heading up the public health program up at CSU. We can't do what we do unless we have faculty in other schools as well as out in the community in the health departments. We have 11 adjunct faculty at CDPHE, Tri-County, and El Paso health departments, 5 affiliate faculty at Kaiser, National Jewish, and Denver Health, 31 faculty in the School of Medicine, School of Pharmacy, UC Boulder, and UC Colorado Springs, with secondary appointments in epidemiology. And we have 4 clinical and volunteer faculty who are individuals who are out in the community. This is important because while we do conduct research at this academic institution, so much of our research is collaborative. And it spans from collaborating with the School of Medicine in almost an etiologic basic science approach all the way out into the community. It's very difficult to separate our research mission from our training mission because our students drive our research, similar to what Denny and I'm sure Sheena said earlier. We have PhD programs, Masters of Science in Epidemiology, and MPH in Epidemiology, and soon the new Global Health Concentration and Epidemiology in MPH, and our DRPH and a Preventive Medicine Residency program. In 2012, we had 89 students enrolled in our epidemiology programs. 62 students were pursuing their MPH, 55 at CU and 7 at CSU, and 3 of these were preventive medicine residents. 4 students are working on their master's, which was a relatively new program, 18 students working on their PhD, and 5 students working on their DRPH. We have the privilege to hear from one of our PhD students today, Brittany Fredrickson. It is really difficult to mention all the different research areas that we're doing in epidemiology. Similar to what Sheena said, I hope nobody's offended if I leave anything out. We work in environmental epidemiology on both campuses, life course epidemiology and developmental origins of disease, injury epidemiology and prevention, nutritional epidemiology, veterinary epidemiology up at CSU, genetic epidemiology, and foodborne disease epidemiology. And I noticed when I was after I had put the slide together and submitted it to Tim, that these are all sort of more methods-based epidemiology. We're talking about the risk factor and moving forward. And I have to say that we work in cardiovascular disease epi, diabetes epi, obesity epi, cancer epi, and we use all of these methods and tools because all of these factors factor into the complex nature of the diseases that we research. Speaking of research, approximately $5.7 million of research funds goes to research projects in epidemiology. Plus, we have substantial overlap with the Rocky Mountain Prevention Research Center, the Center for Public Health Practice, and the Center for Global Health. In 2012, faculty at CU and CSU in epidemiology published 145 peer-reviewed scientific publications. Of the 83 peer-reviewed scientific publications by CU faculty in 2012, 20 of these included student authors. Again, the essential impact of students on our research mission. We do a lot of collaborative research. We have local and regional epidemiologic studies, the Rocky Mountain Prevention Research Center, which includes the site of the prior San Luis Valley Health Study, the Healthy Start Birth Cohort Study, and the Colorado Colorectal Screening Program. We also participate in very large national networks and consortia, such as the Search for Diabetes in Youth Project, the Diabetes Prevention Program, the National Children's Study, the TEDdy Study, IRIS Family Study, COPD Gene, Guardian. A number of these, again, span the mission of our research in genetic epidemiology, nutrition epidemiology, life course epidemiology. I thought I would focus a couple of the newer programs that are coming through epidemiology. This does not limit all the different things that we're doing. The PIPER program, Pediatric Injury Prevention, Education, and Research Program, is a new initiative led by Dr. Carol Runyon that aims to contribute to the reduction in child and adolescent injury and its outcomes in Colorado and throughout the world. Through research, education, and prevention activities, PIPER will achieve its mission to facilitate scientific discovery and evidence-based practice that increases safety, reduces injury and violence, and improves injury outcomes among children and adolescents. I'd like to mention that this is truly a collaborative or interdisciplinary program. There are faculty in epidemiology, HSMP, Health Services Management and Policy, and Community and Behavioral Health, as well as collaborating with the School of Medicine and Children's Hospital Colorado. I'd also like to mention the Integrated Food Safety Centers of Excellence. This is funded by CDC, one of the 5 such centers in the nation, led by Dr. Elaine Scallon and Alicia Cronquist at CDPHE. It's committed to improving training, research, continuing education, and outreach related to food safety and the prevention of foodborne disease. Members include all of the different aspects that we've mentioned, CU, CSU, UNC, and CDPHE. They host food safety seminars, have a fantastic website, you should check it out, and provides training for students in outbreak investigations. Now, our research is all in good, but if you recall, that very last phrase in our mission is to basically create cutting-edge knowledge that can be applied and put into practice in terms of guidelines or public health. And these are just a couple of examples of the success of our research by the faculty in our department. For example, Dr. Runyon's research was acknowledged by the U.S. Department of Labor as being essential in the formulation of policies on teen work safety. Also, based on her research, Dr. DiGiuseppe and colleagues successfully advocated for changing the regulations for child care center licensing in terms of the use of child restraint systems that conform to all federal motor vehicle safety standards as well as Colorado law. Dr. Norris's research in the area of infant diet and type 1 diabetes, celiac disease, and wheat allergy has been used to revise and clarify infant feeding guidelines in Europe and in the U.S. I will introduce these individually as they talk, but I just wanted to mention that Dr. Tasha Fingerlin, Brittany Fredrickson, a doctoral student in our program, and Dr. Dawn Comstock will be presenting their work and exciting research here today. And this is just a small sampling of all the amazing research that the faculty in epidemiology are doing. Thank you.